Have you ever wondered why frequent bathroom trips at night become more common as you age? It's a question many men find themselves asking as the years roll by. This could be a sign of an enlarged prostate, also known as benign prostatic hyperplasia or BPH. It's a common condition that affects many men as they age, and there's absolutely no shame in it. So if it's so common, how come we don't talk about it more often? To begin with, what exactly is an enlarged prostate, or BPH? BPH is the short form for benign prostatic hyperplasia, a common condition as men get older. It's a non-cancerous enlargement of the prostate gland, located just below the bladder in men. Imagine the prostate as a small, round organ about the size of a walnut. Its main job is to produce seminal fluid, which helps transport sperm. Now, when BPH occurs, the prostate enlarges, and it's akin to the walnut growing to the size of a lemon. This enlargement can compress the urethra, which is the tube that carries urine from the bladder out of the body. The result? It can cause urinary problems, from increased frequency to difficulty in emptying the bladder completely. It's important to note that BPH is not prostate cancer, nor does it increase the risk of prostate cancer. Now that we know what BPH is, let's delve into what it feels like. So, what are the signs that you might be dealing with benign prostatic hyperplasia, or BPH? The symptoms can vary from person to person, but there are some common signs that you should be aware of. Firstly, you might experience frequent urination, especially at night. This happens because an enlarged prostate can press against the urethra, the tube that carries urine out of your body, causing you to feel the need to urinate more often. Another sign is difficulty starting and stopping urination. This could mean you have to strain to urinate, or you might experience stop-and-go urination. Again, this is due to the prostate's position around the urethra. When the prostate enlarges, it can squeeze the urethra, making it harder for urine to flow freely. You might also notice a weak urine stream or dribbling after urination. This is another consequence of the urethra being squeezed by the enlarged prostate. The pressure on the urethra can affect the power of the urine stream and can cause dribbling after you've finished urinating. Lastly, you may have the sensation of not fully emptying the bladder. This can occur because the enlarged prostate can prevent the bladder from emptying completely. This sensation can be uncomfortable and could lead to other complications if not addressed. It's essential not to ignore these symptoms. While they might seem like just a nuisance, they can be signs of a more serious health condition. If you're experiencing any of these symptoms, it's important to seek medical advice. A healthcare professional can provide a proper diagnosis and discuss the best treatment options for you. Remember, knowledge is the first step to managing any health condition. By understanding the signs and symptoms of BPH, you can take proactive steps towards maintaining your health. Don't wait until it's too late to take action. Your health is in your hands, and it's never too early or too late to take care of it. Why should we care about recognizing these symptoms early on? That's the question we must ask ourselves. Early detection of an enlarged prostate, or BPH, is not just about saving lives, but also about preserving the quality of life. When we spot the signs early, we can halt the progression of the disease, preventing complications that may require invasive treatments. It's about safeguarding our well-being, maintaining our dignity, and continuing to enjoy the activities we love without the shadow of BPH looming over us. So if you experience any of the symptoms we discussed earlier, don't hesitate to consult with a healthcare provider. This isn't about fear, but about courage. The courage to face the issue before it becomes a bigger problem. Remember, your health is your wealth, and you have the power to protect it. After all, isn't it better to face a problem head-on than to ignore it until it becomes unmanageable? So, we've learned quite a bit about BPH today. We delved into its meaning, unraveled its signs, and underscored the significance of early detection. This knowledge is power. It armors us against the silent progression of this condition. So, let's spread the word. Share this video with those who might find it useful. Now here's a question for you. What steps can you take today to ensure you're proactive about your health, especially as you age?